In this video, I'd like to introduce you to the CryOmega Vet dual delivery product, what's contained in the kits, and how to give you a brief explanation of how to use both the buds and the cones, which can be used for cryosurgical treatment of benign lesions. For a long time, veterinarians have stayed away from using cryosurgery because of the difficulties in operating some of the older devices that have been on the market. The dual delivery device, as we like to call it, is really that next generation that allows one-handed use, cold temperatures, long freeze times, and so the outcome of that are more effective treatments and, of course, resolution of these lesions that drive both the veterinarian as well as the pet owner crazy. So let me first go over a quick review of what's contained in the kit. So you'll notice as you take the components out that there's both cones and buds that may be used with the unit itself containing the gas. Now there are cone tips, and the way this all connects is that there's a treatment guide for the veterinarian in which they can match up the lesion that they want to treat and the size tip to use. So in this case, let's talk about a cone tip treatment that's going to be 5 millimeters. And so in the kit will be a cone adapter that's placed onto the top of the unit, and I'll place the 5 millimeter cone tip, which I've removed from the bag, also onto the top of the cone adapter. This would be placed over the lesion and the trigger pulled for 3 to 5 seconds, which fills the cone with gas. The gas then now stays bubbling against the skin, which is drawing heat, freezing it really effectively. The key is to keep the cone in place during the entire time it's bubbling and evaporating. Once it's gone, you can remove the tip. There's still some left behind. It's very efficient in my demonstration. You would wait for the flesh color to return to the spot that you treated. It'll be white to begin with because you froze it. Once it turns back to flesh color, then you can treat it again. This is commonly called the freeze-thaw cycles. Now, freeze-thaw cycles may be anywhere from 1 to 5, depending on the lesion, and this will come with some practice. The canister itself will give about 200 treatments, 200 5-second treatments, and when you're done doing the cone treatment, you remove the applicator. Okay. And the 5 millimeter applicator may be disposed of. The adapter is kept with the kit, and that's simply how you do a cone treatment. What also can be done with the dual delivery kit is the use of buds or applicator tips. Here, they too get attached to the top of the unit. It's turned upside down. Trigger again is pulled for 3 to 5 seconds. Release. Now the tip itself is immediately ready to be used and could be placed directly against the lesion and held there for the number of seconds, depending on the lesion, or it can be removed from the canister itself and used remotely around the patient in whatever location is most appropriate. And if you have a lesion which is small and you don't want to use the full size of the tip, this can easily be trimmed to whatever size is necessary. And if you're treating multiple lesions, simply go back to the canister, add more gas, use, and when done with that patient, this again should be disposed of in the normal trash. Now, the canister itself may be returned to Cryo Concepts, where it's cleaned, refilled, and may be used again in future product. To achieve that, we include a small clip and instructions inside the box on how to ship it back to us, and we even include the postage paid. This is our way of taking an environmental stance and being responsible in minimizing our environmental footprint and not putting things into the landfill. So overall, I think you'll see that this is a really easy to use, flexible way to perform all requirements for cryosurgery, whether with a cone or a bud, as well as do the right thing for all of us in the way we manage and use the product. Thank you.